By the time people reach 40, there's a higher chance that a life-threatening disease is taking root. Advanced Body Scan has the latest technology to detect a serious disease in its early stages, even before symptoms appear. Founder Steve Mahler explains how it works and how it can save your life. Steve, I was talking to a friend the other day who thought he might be having some heart condition, and then he showed up at the hospital and they said, okay, we're going to do an EKG. And I want people to understand the difference between an EKG and what we get with an advanced body scan.
So, the EKG looks at the electrical system of your heart, and it's a great test. And it's simple to do, and a lot of ERs use it, rightfully so, but it's typically to monitor after you've had an event. So it's not really a preventive screening. That's why most people don't use it as preventive. We scan for blockage in the arteries and vessels in and around your heart, because the blockage is what causes heart attacks. And of course, 50% of all heart attacks are fatal.
Yeah, so EKG can show that something happened, but what you're trying to do is avoid that
Correct.
Something from happening.
Yes.
You started Advanced Body Scan because of what's happened in your own family.
Yes, my mother passed away from a late stage cancer diagnosis, and being around the medical, it still affects me to this day. I'm sorry. She suffered tremendously from the post-care of the cancer diagnosis. She had surgery, she had all types of care afterwards, and that was a spiral to death, unfortunately, and it took several years, and it was very tough on her and all of us in the family. And I knew this technology existed, and I thought, why aren't we using this more proactively in society? And I know it's there. We can use this to find cancer and heart disease at early stages. And so that's what set me on this mission. And to this day, we put my dad in right after we got started, and to this day, 10 years later, he's still alive. He's going to be 88, and we've detected all kinds of things. First day we put him in, we found out he had a defective heart valve. He's had carotid surgeries and recently a cancer diagnosis, which he just finished 28 days of treatment on that and is doing okay.
Yeah.
So.
And Steve, the thing I find so amazing about this is that we tell people all the time, get checked up here, check up here, check up here. A lot of us are not going to go to several different places to get a checkup. When I went through and got the scan done, what gave me peace of mind is from head to toe, I could, you could detect what issues I might have, no matter how small. There's a little issue that I had that I've gotten taken care of, but you can also find the big things. The other thing is, there it is right there. You're not going through this thing that's very claustrophobic. It's just like a little donut that passes by, so it's easy. Your clothes are on, there's no dyes, but the point is to prevent something before it happens, or find something in that early stage when it's much more treatable.
Yes, and speaking of the heart, there's no check engine light on the heart. And these diseases, both cancer and blockages, are long-term progressive diseases. So you don't just wake up one day and all your arteries are blocked and you have a heart attack. It takes time for that to get to a point. But most people have no symptoms of this, even when it's serious.
Yeah.
So,
to that point, you had a man come in who I think you said was he was Ironman competitor, the whole bit. So he's like, I'm healthy. I'm doing Ironman competitions.
45 years
yeah,
old.
45.
Yeah, 45.
Okay. Once again, we think that these things happen to people much older.
Right.
So 45, he came in, he decided to get the scan done, okay, whatever, and what did you find?
So this gentleman who is very fit and looks very fit had 3 kidney stones, 2 hernias, and worst of all, a cyst, possibly a tumor on his lungs that he had no clue whatsoever.
Wow. But because there's early detection, chances of recovering from that much higher. Okay, so we talked about how it basically works, but this is the highest technology. It's a different scan than many people may be used to.
So yes, we have developed protocols for scanning large areas of the body. If you think about most medical scanning, it's done in a certain area because, I've got a shoulder pain or a knee pain or whatever. Mm-hmm. So we look at that spot and we just scan that area. We scan a wider area, and we've developed these protocols to be able to look for telltale signs in those larger areas. So if you find it early, we can fix it early, like you just said.
Yeah. All right. So after the scan is done, the information is sent to a radiologist?
That's correct. Every scan we do, whether it's a promotional scan or whatever, is read by our board-certified radiologist, Dr. Anthony Sparks. You're going to get a full report from him, a radiology report, as well as a calcium score on the heart, and then a consult with one of our mid-level professionals. And I implore people, when you get this report, please take it to your doctor as well.
You have preventive heart and lung scans. So there's different types of scans. You can get the preventive heart and lung scan, which are the two biggest killers of people, but don't need to be, right? But if somebody chooses, they can also get a full body scan, which is a different program.
So when you come in, we're going to do about a 50-minute health consultation, and we're going to talk about all the programs that we have, all the different types of scans that we have as well, and it's an amazing value.
Yeah.
There's nothing like it.
Because people can use this as part of their preventive health care, which is, to me, we show up oftentimes when something's really wrong. Why don't we show up before something goes so
Absolutely.
wrong? And it will be, and you've already seen it, a lifesaver.
I have a friend in Dallas that has a concierge doctor, and he's a well-to-do gentleman, and he pays, and I verified this, and I wouldn't say it if I hadn't verified it, he pays $120,000 a year to this doctor. And guess what? The doctor sent him to us because he can't look inside.
Yeah.
And we found findings on this guy, and he's just shocked. And of course, the doctors called me and said, "Hey, we need a program to work with my patients." And because it is unusual, but it's every day we have findings from
that would have
doing
been
the
missed.
scans.
They otherwise would have been missed just because you can look inside the body.
The best doctors in the world can't see.
Yeah.
Can't detect.
All
So.
right, Steve. Thank you very much.
Thank you.